Welcome, everyone. This is the weekly deep dive into mental health history brought to you by The Broken Brain. I say weekly. Hopefully, I mean W-E-E-K, not W-E-A-K. Am I right? Anyway, this is a Patreon special that happens every week. You'll hear one of these every month on the regular feed, and that's what this one is. This is the history, this story for everybody in the podcast listening audience and the world, as a matter of fact, for the month of April 2024 AD. And that's what this is. So enjoy this peek. The patrons got to hear this last week and are hearing actually a different one that's releasing today as well. A little bit about the history of the autism movement and why the puzzle piece is not very popular as an imagery with many people on the autism spectrum. So that's a lot of fun to research and talk about as well. So enjoy this show. Welcome back. It's this story of history, of mental health, mind you. Today, we're going to be talking to you a little bit about lobotomies, especially a very interesting individual by the name of Walter J. Freeman. And we're going to talk about taking lobotomies on the road in a touring van. So we'll get into that. I'll give you a little background of what we're talking about and where this has come from. So lobotomies have a very sketchy history because they're a very sketchy procedure and cause a lot of destruction and heartache for a lot of people, but not all, interestingly enough. So we're going to, let's dig in. If you haven't heard of a lobotomy is a medical procedure that severs some of the parts of the connections in some of the parts of the brain, particularly up in the frontal lobe. The most extreme versions of this, and if you've seen One Flew Over the Cuckoo's Nest, you're seeing the most extreme version of that for sure, a fictionalized type of thing too, but the actual literal surgical removal of part of the brain to help with what it was supposed to help with. We'll get into that. A lot of these kinds of things were defined by behaviors at the time. So people who had hallucinations, who were irritable or in some cases aggressive and violent, oftentimes who were in asylums and settings like that, were thought to be, well, we got to do something. Anything was justified in that. Well, a lot of the things were purely viewed as behavioral. And the fact that some people, after some kind of surgery like this, behaved calmer, although not all, but because some people did, it was thought of as something that was good. And the goal of lobotomies, as far as I can tell researching, is I've never seen anybody say that they were supposed to cure any problems. What they were supposed to do is calm the patient down, which goes to a deep dehumanization of those with severe and persistent mental illness. I wish I could say that dehumanization has stopped nowadays. However, we are a little more cognizant of that humanization need and also legal rights that can, in many cases, protect people from kind of procedures that one would perceive nowadays as quite barbaric even. And approximately 50,000 people went through this procedure. And here's an interesting reality, which about 5% of these individuals died from the procedure. And so that was apparently considered for something that was already life-altering in a way that was not meant to be curative. For some reason, that was thought to be an acceptable risk factor of death during a procedure that, once again, was non-curative in nature. This procedure was first experimented with in the 1880s. There was some experimentation on dogs and chimpanzees. Interestingly enough, in the chimpanzee studies I've read, that it looked like about half the chimps got more aggressive after. So once again, what were the acceptable margins of likelihood of success? And by the way, 50% in animal experiments doesn't mean you can project that into 50% chance of helping humans. That's not how that works, but it's still not a good start. First procedures look like they were recorded in Switzerland, and then this caught on in the U.S. and also in Portugal. There are many, and this was a worldwide phenomenon in many countries as well, but that seems to be where it got its start. So enter Dr. Freeman. We're talking the 30s and 40s, the beginning of his career, and stretching on into the 50s and finishing up in the 60s. We'll talk about the finish. He became a champion of this procedure, performed several of these lobotomies before he pioneered what he called the transorbital method of lobotomy. Transorbital, also known as inserting an ice pick through the eye socket into the brain and doing the deed that way. The reason that this was such a feat, in his opinion, and unfortunately the opinion of many people, was that this allowed the procedure to be completely outpatient and could be done just in a psychiatrist's office. Also, because of the nature of it, and I think because of laws at the time, people who weren't necessarily specifically trained in any type of surgical procedure could still learn to do this in the way. So the insertion was done on a patient who generally was lying down. It would go through the corner of the eye socket in such a way that it was intended not to damage the eye. And then a little hammer was used to tap, tap, tap. So this is gross, guys. Sorry about that. But I did find an account from Frank Freeman, who was Walter Freeman's son, talking about the first time that he helped his father perform one of these lobotomies on a patient. I didn't find whether or not he was actually a doctor, but once again, Walter wasn't necessarily big on someone having a ton of training in order to do this procedure. So there's a quote from an article that was in the Washington Post called "The Lobotomist." It's about a 20-year-old article, but he talks about how first the patient was knocked unconscious with 2 or 3 jolts of electricity from an electroshock therapy machine. I was there to hold the person's legs down, Frank Freeman says. We all went for a ride when he threw the switch. So I did not know this, by the way, that electroshock therapy was utilized in order to render a patient unconscious for the procedure. I surely did not know that somebody was holding them down and getting shocked as well. That's kind of a revelation there for sure. The writer goes on, after the convulsions subsided and the patient lay insensate, Walter Freeman lifted the patient's eyelid, inserted an ice pick-like instrument called a leucotome through a tear duct. I'm not sure if I pronounced that right. A few taps with a surgical hammer breached the bone. Freeman then took a position behind the patient's head, pushed the leucotome about 1.5 inches into the frontal lobe of the patient's brain, and moved the sharp tip back and forth. Then repeated the process with the other eye socket. So apparently they did it with both eyes. And once again, that is an article called "The Lobotomist" in the Washington Post by Jack L. High. February of 2001 is when that was posted. So old thing, but it's just reporting history. That hasn't changed. So performing this with his son, shocking the patient and shocking his son apparently as well. This was something that Walter Freeman was very proud of, coming up with this technique that allowed it to be done quicker, easier, and by anybody. Now, I would say anybody. I don't have any evidence that he just had complete lay people perform this, to be fair. But he did go around the country and tour and train asylum workers and doctors on how to do this in their offices or in asylums. So you can see where not only was he performing, and by the way, in his career, he performed some 3,400 of these procedures, according to his own records. One of the interesting things is it was after his colleagues started to become disenchanted with some of the side effects of lobotomies that he started this kind of traversing around and training people and trying to get this to catch on. It was, unfortunately, it was done in many asylums. So beyond just the ones that he performed himself, we could say he is directly responsible for many of these procedures being done as well. So if we're talking about negative side effects that people experienced, we're talking about things like irritability, lower self-control, less independence. If you think about what's right behind the eye, well, that's the frontal cortex, folks, and it involves a lot of those kinds of things. People were not able to function as well. If you want to learn more about this, a great resource to look at is a book by Howard Dulley called My Lobotomy. It was one of the later instances of lobotomy being performed, and it was by Walter Freeman who performed this on him, and he's been pretty vocal. I used to follow him. We had a little bit of exchange talking about his experience on Twitter several years ago, and so it was very interesting. He's very much against the practice and the effects that it's had on his life. So that's an important name, Howard Dulley, if you're interested in learning more about this. And his lobotomy, by the way, was performed in December of 1960. So this was going along. Now, here's a really interesting bit that we can find here is that at this point, once again, this was when Freeman was having fallings outs with his colleagues about the side effects and some of the risks inherent to this procedure, and some of the ones he did lead and cause great harm and death. He decided that what he would do is start to travel the country, literally, in a van, which he called the Lobotomobile. At least according to one source, that was a name that he came up with, that he would travel around and he would perform these in front of media and crowds. He was apparently very charismatic, engaging individual, came across as a charming eccentric of sorts, and apparently was a charming eccentric of sorts. I think we can say that. But he would perform upwards of 20 lobotomies a day, according to some sources that are there. And so this was something in a non-controlled, non-surgical environment, by the way, and was done very much as showmanship. Now, as by all accounts, and from what I can tell, Freeman was a true believer that this was doing good. So I want to make sure that I'm, for whatever that's worth, that is the context. However, I think that sometimes fanaticism and commitment to something, especially when you believe it's a cure-all, can lead to a lot of poor decision-making and a lot of confirmation bias in how you interpret what's going on around you. And Freeman, obviously, at least for the large part of his career, and I will just say I can't find any record of him saying anything negative about the procedures. Maybe I just didn't dig hard enough. If anybody out there knows anything about that, please just hit me up. Let me know. I'd love to find any evidence that he had any doubts about it at any point. I have not been able to find that. Whenever you hear somebody come across with a cure-all, this is going to do everything, this is going to replace everything, this is going to, that's something you have to watch out for quite a bit. I remember several years ago, there was a push towards binaural beats, I think is how you pronounce that, where you would listen to these sounds through a pair of headphones. And there are all kinds of claims of what they could do to correct depression, to cure sleeplessness, and to cure autism. I had several parents who someone who works with those on the autism spectrum. I had several parents and people who reached out to me to say, do you think this works? I didn't know much about it. I will just say I never tried it. I don't have a great knowledge of it other than a couple of things. I could not find any medical evidence that it should work. And as a matter of fact, there's counter indicators. That doesn't mean it can't work. There's lots of things that we don't know exactly why they work. On the other hand, the only research I could ever find, if you want to, I'm air quoting research here, was customer testimonials. That's worth something, but it's not research. Okay. I've known people and clients who've gone through it, and while they found those things to be calming, I surely don't know of anyone whose symptoms reduced or disappeared of any kind of mental health diagnosis. So anecdotal, that's what I've seen. Can't find any research on it. And it certainly does not, in my experience, match the level of its promises that it makes. So when you hear things that are spurious in nature, the promises seem pretty extreme, and particularly when they are billed as a cure-all. Let me give you one other example that kind of goes the other way. There is quite a bit of research about this one, and people that I've known have, let's just put it this way, every client that I've worked with has had some positivity from this kind of treatment, and it is a very small percentage that have no benefit from it, and that is ketamine therapy. You've heard me talk about that, and I've interviewed people who've received ketamine therapy, and Dr. Stephen Mendel, who is one of the pioneers in that area. And I'll say this, those that bill that as a cure-all that's going to make your depression go away and that, it'll be, boy, you go around a treatment and you're good forever. That's just an exaggeration. It's somewhere now. It's very successful, very low, if really any long-term side effects. It seems to be very safe. The biggest risk is you fall into that, whatever it is, 15 or so % that don't get any benefit at all. That's the biggest risk. It just doesn't help. The larger chances that you fall into the majority that get at least some help. But even amongst those, it doesn't necessarily change everything forever. It does seem to long-term reduce suicidal ideation. It does seem to have a persistent effect, but people do have to go in and get periodic treatments forward. Now, a great ketamine provider will tell you, don't stop doing your therapy. don't stop taking your meds. Do this. Let's see how your symptoms are going. Consult with your psychiatrist and keep moving forward and use this as a tool in managing your mental health. A very effective tool. I want to be clear. At the same time, anybody who's going to say, this is it, this is going to make everything better, watch out for that. Look into it, ask a few other professionals, get another opinion. And especially those that are practicing ethical professionals will usually help you find whether or not something is spurious or whether it's being exaggerated. So that's just a little bit there about cure-alls and about how that can overwhelm people's judgment. So now, to be fair, and I guess I try to be a fair person as much, as I can, as much as any of us can. In my researching this, I did come across a couple of accounts where people did say that they got some help and that they felt like their lobotomy did something for them. It seems that a huge percentage of people had very negative experiences. And by the way, if 5% death somehow sounds acceptable for a very optional procedure that is non-curative, if somehow that sounds okay, to somebody, let's just put it in perspective that the loss of quality of life is a very pervasive and much more common thing that you'll find in many treatments. So just avoiding death is not the same thing as having a really healthy life. However, there are people who said that it improved their quality of life as well. I did find an account on, this is at an NPR Oral Histories website. It's called Walter Freeman's Lobotomies, Oral Histories. And this is from back in 2005, but there was an interview from a woman who received a lobotomy in 1962. Her name's Matricia Moen. It's Moen. And so she and her husband were interviewed for this oral history, and according to the transcript, they both said that after that it was easier for them to get along, that their relationship benefited, and she said for herself that she was glad that she did it. The exact quote here is, "I was a more free person after I'd had it, just not to be so concerned about things. I went home and started living, I guess is the best I can say. I started living again and was able to get back into taking care of things and cooking and shopping and that kind of thing." It's a quote from her husband, Glenn, where he said, "It was easier for us to get along. I did wonder to myself how much good did this operation accomplish for her." So there we go. Okay. Now they do say they were at the point of not getting along, to the point where she was considering divorce, and that after that they were much closer. So I don't want you to misconstrue what I'm about to say, but I will say this, that most of their good experiences, emotional connectivity, great and very good. A lot of the things that they do say about the good effects did seem to circulate around behavior and actions. And as I just read, being able to take care of things and do cooking and such. And I have no idea how this couple lived their lives, and I have nothing to say about, whether or not gender roles played a big thing in their personal thing. However, I will say, back over on this other side, that research indicates that 60+% of these were performed on women, and that oftentimes the reporting, and especially during those days, a lot of the presenting problem for women who came into mental health treatment was under strong recommendation of their doctors and husbands, and had to do with basically, making waves, I guess you could say, or just not tying in so tightly to some of the traditional gender roles. Now, you can also, once again, on the other side, you can argue that societally, that was the norm, and that could be considered maladaptive if a person wanted that lifestyle. But the question of whether or not women wanted that was not actually considered so much. And if you didn't, that could be considered to be a mental problem, and that, I think, is problematic. So another group that seemed to be heavily targeted, so let's say 60+% women. Within the other percent, and I didn't find a percentage on this, but there are reports that within the other percentage, the remainder, which are men, there was a disproportionate number of gay men who were targeted. And once again, at the time, being homosexual was considered to be a mental health problem by many people. Unfortunately, I guess you still see that, but thankfully that is much, much in the minority. That's a really loathsome belief that still, I guess, is out there, and you see that being perpetuated on people who are transgender and other things like that still, unfortunately. But that was much more predominant at the time, and did lead people to get lobotomies for their sexual orientation. So once again, I got to say the evidence here is amongst the 95% who didn't die, that there was some real dangers, both in the quality of life risks and also the reasons why they got them, that maybe they didn't need them at all. When Dr. Freeman would wheel his way into your town in the van, I got to tell you, the thing that comes to my mind is Pete's Dragon, if that wasn't already on your mind. If you think of Dr. H. Parnassus, I think is the name, just off the cuff here. The old Disney musical, there was a remake several years ago, but further years ago, there was the original Disney musical, very charming little Disney musical about a boy and his sometimes invisible dragon who helped him out and, rescued him from bad situations. But there's a character, Dr. Parnassus, who comes into town. He's a snake oil con artist, to the point where he comes into town running away from some posse that was trying to catch him. And his assistant puts on like comically bad costumes and comes up to pretend that the cures work. And here's the thing, very interesting comparison. The people were upset and concerned about him being there because apparently he'd been there before in this narrative. And he was able to win them over in one, very fun song and dance, literal song and dance number in this case. But that is the danger of someone who is, and in this case in the movie, obviously he's a con artist. Once again, all accounts seem to point to Freeman being a true believer, but that single-mindedness of looking at one thing to the exclusion of all data that would go otherwise is contagious, because the reason that we get set up for accepting these kinds of things as sort of almost magical is because, boy, wouldn't that be nice if they were, So in 1967, Dr. Freeman performed a lobotomy that ended up in a brain hemorrhaging and death. And for whatever, this was the one that triggered some consequences, especially with some of the concerns that had been out there in medical and mental health community. And he was barred from performing, I should say, any form of surgery. And as far as I can tell, that ban was never lifted. That woman's name was Helen Mortensen, who was a longtime patient of Dr. Freeman. And this was the third time she'd received a lobotomy by him. So that's a whole nother ball of wax. I don't know how many times these services were performed multiple times on the same person. That just popped up at the end of my research time, and that's another thing to maybe go down that rabbit hole and see if it wasn't even working to the point where people weren't feeling like it was working. So it was the very next year that Dr. Freeman retired, and then he continued his travels to do follow-up studies of lobotomy patients. And that might be a good topic for another time. I didn't find any with a cursory look, but with a little more time, perhaps I could find out. That might be a good place to see what he thought about it after that. He died about 5 years later of cancer. Psychosurgeries were phased out in asylums and inpatient acute care units with the advent of psychotropic medication. Thorazine in particular was used for a long time. That'd be a good history as well to get into Thorazine. I worked in a place in the early 2000s that was still using Thorazine. And so I've seen that up front, how that was used in behavioral crises and things. So, it's better than lobotomies. That's my hot take for now, but we'll see what the research indicates. Maybe I'll bring that back to you at some point. So if you are a person who has a big problem with psychotropic medication, I'll just say this. I've said it on the program before. Those medications can be life-saving, are life-saving, and quality of life-saving for so many people. And I feel like that is, if you don't like me saying that, I'm sorry. It's just objectively, observably what we see. Are there problems with those? Yes. But I would just invite you to kind of think a little on the fact of what it is that they replaced. Okay. And do we replace them someday? That'd be awesome if we can get to a point where we don't need those. Or it would be just as awesome if we get to a point where they work so much better and it's the same as, any other, and it's viewed socially the same as taking your heart medication, your diabetes medication, and those kinds of things. So, it would be great if that were better than it is, but it is better than some of the things that predated it. And I'd encourage you to keep that in mind as you evaluate the use of those things. Lobotomies, by the way, are not banned. They are still legal in the United States. Some articles I read said that there's reports of them being done as recently as the 1980s, which isn't as recent as some of us forget that it isn't if we grew up at that time. But it's a while back. But still, I can't find any way to. There's no way to guarantee that they're not happening now, and they certainly probably are somewhere. Interestingly enough, in Russia, they were made illegal in the 1960s. So, I don't know. So there's the thing. But just something to keep in mind that they have not been made illegal, and maybe the impetus for that would be if they were still being used. But also there's no evidence that they're in any kind of widespread use, and I couldn't find any reported incidents of anybody on record of doing them. Now, once again, I want to paraphrase. I when I do these historical backgrounds, I really, really welcome anybody who knows more about this than me or can find things that I didn't. I am not a historian, but I am interested in the history of mental health, and I do, dig around for factual presentations for these things. And so, for example, I'd heard the stories kind of anecdotally that Freeman drove around, but I dug around to make sure that the Lobotomobile was really something that actually happened before bringing it to you today. So I do try to do my due diligence, but please let me know if you've had any experiences of this, or anyone who's had experiences. I'd love to hear about that. Maybe even feature it on the show if you or someone that wants to talk about it, or just wants to share things that you'd like me to share with the audience. And that goes for anything as well that you'd like to share with the audience. Appreciate all of the interaction I get with the Broken Brain community. So I'll be back at you Patreon patron brainiacs. Sorry about the plosives there with the P's. But I will be back with you again next week as we dig into the autism spectrum, the use of the puzzle piece as a logo, and why many people don't really love that very much. And for the rest of you, I'll be back again next month with another Thursday History. There'll still be normal episodes before then, too. Bye-bye. Hey, real quick, it's Dwight again. The name of the con artist from Pete's Dragon is Doc Terminus, actually. Abraham H. Parnassus is the name of the oil baron who came to his son's parents' career day in the Saturday Night Live sketch played by Adam Driver. So somehow my brain got that mixed up. I thought of going in and dropping Doc Terminus in there or re-recording that part. But guess what? I thought it was funny, and maybe you guys would enjoy laughing at me. Have a good week.